For all of us who menstruate or used to menstruate, I'm sure we have all had symptoms that were normalized. This has been one of the biggest reasons why we have negative outlooks on our periods because of the symptoms we think just come with our cycles. Hey everyone, welcome to Be Divine, Be Well, where we will be discussing all things women's health. I'm Jess from Journey to Naturopathy, and I'm hoping you will leave these discussions more empowered to take control of your health, to ask the right questions, and to recognize that you are not alone. On this week's episode, we are joined by Dr. Laura Pipher, an ND and founder of the Period Passport online program. She believes that while period problems are common, it does not make them normal. Today's topic will be on just that, period problems and how we can change the conversation around our cycles. Let's dive in.
The first thing that's really interesting is when I talk to patients, I often start by saying there are different tools. And so we know naturopathic doctors have different tools in their toolbox to be able to treat with. And unfortunately, the tool that conventional medicine has for period-related problems tends to be birth control, ablations, and hysterectomies. And so those are your three options. Choose one. So I find that a lot of times these things are normalized because the medical profession really doesn't have any other answers. There's really nothing else to do. And so a lot of time it's like, are you dying? Do you have endometriosis? Do you have fibroids? Do I need to remove your uterus? Like those are the things that they're going down the line. And if you don't meet that criteria, then you're fine. A lot of times heavy periods, painful periods will rule your life. They spend days at home. They miss work. They miss school. They miss social events. Like it is insane the amount of people that feel like crunching up in a ball in their bed is a normal thing. The other piece of that is they actually did research and they found that young girls, only 4% were likely to actually speak to their doctor regarding period related stuff.
Wow.
So what they were saying is that most women, most young girls actually get their period related information from their mom. And if their mom doesn't know it, then guess what? They don't know it either. And it depends on what sort of culture you grew up in as well. A lot of cultures, there's a lot of shame behind menstruating. Women are not given menstrual hygiene products. A lot of women are made to feel dirty. And so if we look at that, it's really no fault of our own that we know nothing about the cycle. It's barely taught in school. All they teach is abstinence, basically. And they also separate the boys and the girls. And so we both learn different things. And so you can understand why women feel shame and embarrassment when it comes to their period. And that leads them to not ask questions. There's a lot of patients that I speak to who are 30 years old and now they're trying to get pregnant. And they say, wow, I've been going 15 years with something that I haven't told anyone about. So I don't even know if this is normal. I don't even know how common it is because I felt like I had to keep it to myself. And so there's a really large stigma surrounding our period. And if we're not getting the education from our doctor and we're not getting the proper education from our parents, and even when you become a nurse or a doctor, there's not a lot of time spent talking about the normals and the non-normals of the menstrual cycle in those curriculums as well. So having said all that, I find that heavy periods, painful periods are commonly referred to as normal. There's a few causes, things like fibroids, endometriosis. Those are structural causes. So that's a secondary dysmenorrhea. The most common form is actually primary, where you have painful periods without a known structural cause. And just because there isn't a known structural cause doesn't mean there's not a known cause. That can happen for a few different reasons. And the first reason that I find to be extremely common is when we have anovulatory cycles. I always explain first half of the cycle is dominated by estrogen. Second half of the cycle is dominated by progesterone. You're basically developing a follicle. This is the egg that you're going to release upon ovulation. And so what happens is you have estrogen and it's kind of rising and rising and rising. It's helping those follicles kind of develop. Once estrogen is hitting that peak at the top, your body's deciding, okay, we're choosing this dominant follicle and we're going to release it this month. Then we have something called luteinizing hormone. It comes up and it comes to a peak. After that happens, your body's supposed to release an egg. And so all of those things have to happen throughout the beginning of the cycle in order to create the environment to actually release that egg. Now, once the egg is released, it forms something called a corpus luteum, which actually makes progesterone. If you don't actually release that egg properly, you're not going to have that progesterone. And so the imbalance in estrogen and progesterone alone can cause issues. Progesterone, it helps to oppose the actions of estrogen. When we're not opposing the estrogen kind of continues to build and build and build. And now we have a high estrogen type picture. And then what can happen is we have a lot of lining. I mean, that can cause heavy periods, but it can also cause painful periods because that cramping action can occur because of that. And so when we have anovulatory cycles, that's a main reason for heavy and painful cycles. And also having that estrogen dominant picture, what that means is that your estrogen is high relative to your progesterone. And so if you're not ovulating, that estrogen is going to be high relative to your progesterone. But even if you have estrogen that's like normal and your progesterone is low or even normal, it can still be a relative deficiency of progesterone. And those can lead to many symptoms, things like PMS, heavy periods, painful periods, spotting between periods, all of those sorts of things. And these type of hormonal imbalances are often not even looked at. And so it's important to understand that those imbalances can exist. And it doesn't necessarily mean that your blood work is flagged for it to be an issue. Let's talk about ovulation, because a lot of women, they don't know when they ovulate and they don't know how to know. They assume that when you log your period in your app, whatever your app tells you for ovulation is true. And there's a couple of reasons why that's not true. Number one, if you had a perfect cycle, 28 days, you would ultimately be ovulating like day 14, let's say. But that's not the case usually. Some women ovulate around day 12, some ovulate day 15, some ovulate day 21, and those women probably need some cycle support. That's something we need to know for if you're trying to conceive, if you're not trying to conceive. This helps me look at your hormonal balance. This helps me differentiate what's going on in the first half of your cycle to the second half of your cycle and understanding when the second half of your cycle starts. So we need to know when you ovulate, if you ovulate, and that helps us put the pieces of the puzzle together. Understand that your app is just using math. It's taking your average cycle, it's dividing it in half. That's it. If you start to actually input your actual ovulation in your cycle, your predictions will start to get better. So what I tell people is start with monitoring your cervical mucus. So that's basically the discharge that you are seeing on your underwear. It should change throughout the month. What you're seeing is as you get closer to ovulation, the estrogen changes the composition of your discharge and makes it more raw egg white-like. Once you see that, you're likely to ovulate within about 2-ish days. So once you see that, you mark it down. And if that's on day 20 in a 28-day cycle, then that's a problem. If you don't see it, then that's a problem. If you see it for like 5 days or longer, that's a problem. And if you see it twice in a cycle or more, then that's a problem. So then we can actually start to understand what's going on with our cycle. And I find that once women actually feel empowered about their cycle and knowing how to track it and what they're looking for, and you can start to feel when you ovulate, and you know when your mood changes, you can actually correlate it to, oh, I'm this day of my cycle and I know that these hormonal changes are occurring. You feel a lot more confident to not only track your cycle and understand your hormones and approach your doctor or naturopathic doctor with these concerns, but you also feel more confident to avoid pregnancy or get pregnant.
Yes, yes. Health literacy, it empowers people to ask the questions and also understand their body, get a little bit more intuitive with what's happening within their bodies. I think that's another topic that I want to get into is the emotions with periods. I think that's a topic that is very much normalized. It's just, yeah, you have PMS. No one thinks it's a problem.
Yeah, it's funny because when I talk to patients, one of my questions is, do you have any mid-cycle symptoms? A lot of times they're like no acne, no breast tenderness. And I'm like, well, are you irritable? Do you have any mood changes? Oh, well, yeah, like my partner knows when my period's coming. I'm like, okay. So that happens normally in that second half of the cycle, that luteal phase. So we are ovulating, our egg makes a corpus luteum and it's supposed to make progesterone. A number of factors can impact that. So we already talked about not ovulating. Not ovulating can lead to low progesterone. But other things that can lead to low progesterone include things like high stress. And so what happens is we have something that we refer to as the cortisol steal effect. Basically what happens is progesterone and cortisol need to be made by the same backbone, which is cholesterol. If you are stressed, then your body will favor making that cortisol hormone over making your sex hormones, because if you're stressed, it's assumed based on biology that you're running from a bear. And so if you're running from a bear, reproduction doesn't matter anymore. So we make this cortisol hormone, and as a result, our progesterone levels actually suffer. And so when cortisol is high, progesterone can be low. The other piece with cortisol is that it actually reduces the sensitivity of your receptors in your body to hormones. So you actually need more hormone to do the same thing that they would have normally. And so stress can be a big reason why you have missed cycles, heavy cycles, spotting between cycles. If your progesterone and estrogen aren't balanced, then that's a problem with your cycles. And so that can be due to stress. That can be due to not ovulating. That can be due to something called xenoestrogens, external estrogens that are fake. So these synthetic estrogens, these are things like birth control, chemicals, so things like pesticides and a lot of flame retardants, and plastics, plastic water bottles, plastic food containers. One of the first things I tell my patients is purge your plastics, because they have such an impact on your hormones, even BPA free, even when you don't heat them, stainless steel or glass. I tell people to head to the environmental working group. They have a complete list, and they're a great resource for chemicals. Things like the Dirty Dozen and Clean 15 will be found on there. They act like fake estrogen. They take estrogen's place, but what they do is when they get a hold of the receptors that estrogen normally goes on, they take hold and they have a much, much greater effect. And so that's a problem when we look at things like endometriosis. We look at estrogen dominant cancers, but also period problems. And so anything that really disrupts that balance will cause mood issues among other stuff. The other thing we can't ignore is the role of the thyroid in period concerns. And so making sure that if you have absent periods and you have heavy periods or anything like that, as well as when we look at that mental health piece, we need to really look at the thyroid. And by that, I don't mean just looking at TSH, but looking at the complete list of blood work that we need for the thyroid to give us an actual window into what's going on. The last big piece of that is digestion. So first of all, a lot of women don't realize that their serotonin is actually made in the gut. And so we have to have a healthy gut in order to have a healthy mood. And so those changes can actually be exacerbated if you have digestive issues. And the reason why is your hormones are processed two ways, through your bowels and through your liver. So what we need to do is we take the hormone, we send it through the liver, phase 1 and phase 2, we break it down, we put things on it to make sure we can send it out. Now we're ready to ship it out, and we send it to the bowels. And now what happens is, if you don't have regular bowel movements, well, now that estrogen is just sitting around, and your body goes, oh, this seems like it's helpful, grabs it and uses it again. That can lead to a relative estrogen dominant picture. So that's something that's known as enterohepatic recirculation. And we're reusing a hormone we thought that was going, because it's not going anywhere. So I always tell women, we need to move your bowels. And the last piece to the gut puzzle is looking at your gut bacteria. There's a lot of new research coming out on the microbiome and how it impacts literally everything. Specifically, there's an enzyme known as beta-glucuronidase. This is an enzyme that we have in the gut. It's made by specific bacteria. What beta-glucuronidase does, its job is to basically unpackage estrogen. So the estrogen that we've packaged up nicely in the liver and we've sent it out, beta-glucuronidase comes around and goes, I'm going to open this package, and lets it out again. And so now we have the same thing happening with reusing that estrogen that we were supposed to get rid of. Now, to a certain degree, we do need beta-glucuronidase. It's not a bad thing. We need it to be balanced. But when there's too much of it, that's a problem. And when there's too little of it, that's a problem. And so having that balance will have to do with gut health, and gut health goes beyond taking a probiotic. It's a whole other topic on itself.
Especially now in a generation where wellness is almost a fad, and you have so many people who might not have the credentials talking about wellness because they found something online. And that leads to people thinking that, I'll just go get a probiotic. First of all, that's not going to solve all the issues if you're not eating properly, if you're not working out, if you have some mental health issues, if you're not working on your other issues that are happening in your body, your hormones, everything, because the hormones in the gut also have this kind of interplay. It's the gut affects the hormones affects the gut. So it's just not enough to think that it's a one size fits all, because we have to look at all the other factors that that play.
At the end of the day, you can have the same symptoms as someone else, and your symptoms can be estrogen or progesterone. Their symptoms can be thyroid. The other friend's symptoms can be cortisol. Getting the right testing is really important. Sometimes that means doing blood work. Sometimes that means doing salivary testing. Sometimes that means doing urinary testing. I say to patients, I can do a clinical intake, but I can't see through you. Based on what I believe is going on, I'll give kind of a laundry list of tests. We might do a specialty test if I'm doing like digestive stuff, or we might do a specialty hormones panel like the Dutch test or something like that. But I find most often I want to start with baseline blood work because a lot of people haven't done blood work in a long time. And I want to look at things like their ferritin, so their iron stores, things like B12, vitamin D, which is always low but never tested, but it's always low to a different level. So no, everybody can't take the same dose. And I see it low in people that tell me they've been taking vitamin D because they're taking the wrong amount. And if you take too much, it is toxic. Oftentimes I'll run something like fasting insulin. Find it to be a really, really big thing in not only PCOS, but a lot of other period concerns. Fasting insulin is high. But HbA1c is normal. And research has shown that fasting insulin actually shows before we have a change in HbA1c. So that's obviously fasting. Doesn't matter what day you go. Thyroid panel, I always like to see fasted. You never treat the thyroid without testing. And a clinical intake is not enough. And treating the thyroid, just going to take, oh, I think it might be my thyroid, so I'm going to go take selenium. That can actually be dangerous. And then when I'm doing anything like estrogen or progesterone, I mean, if we're looking at it for fertility purposes, normally you do estrogen day 3 and progesterone day 21. Often what I'm doing is I'm doing day 21 blood work because I want to confirm ovulation. I look at the progesterone and the estrogen ratio at that point. I make sure progesterone went up enough at ovulation or after ovulation. And so I'm looking for like day 21 and fasted, usually based on what I typically run.
If you have someone like that you're testing FSH or LH, how does that look in terms of days?
Normally that's day 3. So that'll be more of a fertility picture, sometimes a PCOS picture. We'll do that on day 3. Normally it makes the most sense to do day 3 estrogen, LH, FSH, and then do progesterone day 21 and then tack on the other tests whenever is the best time. Really, when it comes to women's hormones, it is a whole body approach. It's not a, can I just take this? So I try to spend my time educating women on how complex hormones are and how it's not a one-step fix. Sometimes it's a lifelong journey between getting the right food, fixing your digestion, figuring out your stress, finding out exactly what's going wrong, balancing your blood sugar, moving your body, making sure you have appropriate detoxification systems in your body as well. And so that's really the foundations, and we have to master the foundations before we can do anything else.
In terms of pain, is there anything that you would recommend to them to try instead of Advil?
So one thing I really love are castor oil packs. So using those throughout the month. I have people who enjoy it as part of their self-care. And so if it's something you enjoy as part of your self-care, then I think it's a really good addition. But I actually saw a study most recently on ginger and painful periods. I actually can't tell you off the top of my head what the dosing is right now, but they dose it in a way that they take 1 capsule every day for the duration of the cycle, and then either the day before, if you know exactly when your period's coming, or the day of your bleeding, you actually increase, I think it's like 3 or 4 caps a day, and you do that up till day 4 of bleeding. Wow. And then you go back down to 1. I've seen it be really effective in 2 months. The study that looked at it, I believe they looked at 6 cycles. It's cheap, it's effective, and it's quite safe. I also like to give it if you have period problems and you're trying to get pregnant, because it's something we can just continue on during pregnancy, something you can keep for nausea and vomiting. That's kind of one of my favorite treatments for painful periods without a known cause. Magnesium is always a good option. It's always a good go-to, but you have to make sure you're picking the right type. I'll usually use a bisglycinate. They take kind of 1 capsule, see how they feel the next day, take another capsule, and if there's no diarrhea, they can take up to like 600 milligrams. Some of my patients can do 800. When we're talking painful for something like endometriosis, we might include melatonin. Things like DIM and NAC can really be helpful, depending on if it's like an estrogen dominant type of picture. Acupuncture is fantastic to regulate cycles, improve ovulation with PCOS, help with anxiety, help with sleep, help with stress. You can also do acupressure. There's a lot of points that you can actually do at home. The research has shown exercise to be just as effective as NSAIDs. Yoga has been shown to be beneficial. Meditation is beneficial. But again, remember that you're competing with yourself. You're not competing with anyone else. So if you can't get through a 30-minute meditation, but you can get through 1 minute, next time try 2. There's a lot of different things. We need to look at your goals and where you want to be and decide what lifestyle changes we need to make in order to get there, and give ourselves a timeline as to how we're going to get there, because it's not going to happen in 2 visits.
What would be some key takeaways for women watching?
First takeaway I would say is download an app. Start tracking your cycles now. If you haven't before, start doing it today. Figure out what's going on. Are you ovulating? When are you ovulating? What are your symptoms you experience? Because it's really hard to recall what you did yesterday, not to mention last month. Number 2 is get the right testing and advocate for yourself. If you want fasting insulin, get fasting insulin. Don't get HbA1c, don't get fasting glucose, because it's not telling us the same information. Get the testing that you need and find the right person to give you that information. For me, I write faxes to their doctors so that they don't have to worry about explaining what they need. So part of our job is to kind of advocate for our patients and really just go easy on yourself. Understand that you cannot out-supplement a lot of things. You cannot out-supplement a poor diet. You cannot out-supplement a poor lifestyle. And monitor your symptoms for 3 cycles before you make any rash decisions or conclusions. 1 period does not a pattern make. And so making sure that we create patterns in our cycle is really important. And then ask an expert. Don't Google your symptoms, because Google can be a rabbit hole. It can be a wealth of information. But if you don't know what you're looking for, then
almost too much information. Yes. Thank you so much for chatting about this. This is a big topic that starts when we're so young, and a lot of us are getting our periods younger now. So I think this is a topic that needs to be talked about more readily within sexual education in schools, as well as when you're in high school, because that one course we all had in grade 6 is not enough.
Yeah.
So I'm very grateful to have this opportunity and share this with people who need to hear this information. I hope you all enjoyed today's episode and learned something new. Please comment below any questions you have or topics you want to learn more about. You can follow me on Instagram at Journey to Naturopathy to keep up to date with any resources and upcoming content. Thanks for watching, and stay tuned for the next episode of Be Divine, Be Well.